Welcome to our exploration of the clinical management pathway in cardiopulmonary physical therapy. In this video, we'll guide you through the essential steps that physical therapists follow when managing patients with cardiovascular and respiratory disorders. We'll cover the importance of thorough assessment, how treatment goals are set, and the significance of outcome measures. By the end, you'll understand how evidence-based practice shapes each decision, ensuring the best possible care for every patient. Let's begin by understanding why a structured pathway is crucial for effective and safe patient management. A clinical management pathway is a structured approach that guides therapists from initial assessment through treatment and reassessment. This framework ensures that all aspects of a patient's condition are considered and interventions are tailored to individual needs. The pathway is cyclical, meaning assessment, treatment, and reassessment are ongoing and interconnected. This is especially important for patients with complex or critical cardiopulmonary conditions, where timely adjustments can make a significant difference in outcomes. Assessment is the foundation of effective clinical management. For cardiopulmonary patients, this involves a comprehensive chart review, patient interview, physical examination, and analysis of laboratory tests and investigations. The goal is to identify which aspects of the patient's pathophysiology are reversible and amenable to physical therapy, and to recognize other factors that may impact function or risk of complications. This thorough evaluation sets the stage for individualized care. The assessment process is multifaceted. It starts with gathering information from the patient's medical records and continues with a detailed interview to understand symptoms and history. Physical examination focuses on respiratory and cardiovascular systems, while lab tests provide objective data. Together, these components help therapists pinpoint problems that can be addressed through physical therapy and those that require multidisciplinary attention. After assessment, therapists generate a problem list. This list includes issues directly related to the patient's pathophysiology that can be improved with physical therapy, as well as other concerns that may affect recovery. Examples include poor gas exchange, decreased mobility, pain, retained secretions, and altered cognitive status. Recognizing these problems is essential for setting meaningful treatment goals and prioritizing interventions. Treatment goals are developed based on the identified problems. These goals aim to reverse pathophysiology, prevent complications, and enhance overall wellness. Importantly, goals should be client-centered, reflecting the patient's priorities and lifestyle. This collaborative approach not only improves outcomes, but also encourages patient engagement and adherence to treatment plans. Let's look at some common problems addressed by physical therapy in cardiopulmonary patients. These include poor gas exchange, decreased cardiac output, pain, reduced mobility, retained secretions, recurrent infections, dyspnea, and altered cognitive status. Each problem requires a specific approach, and therapists must prioritize based on severity and impact on function. Client-centered goal setting is a cornerstone of effective therapy. By involving patients in the goal-setting process, therapists ensure that treatment plans align with what matters most to the individual. This approach is especially important for outpatients and those with chronic conditions, as it fosters motivation and long-term adherence to lifestyle changes. Often, treatment goals are the direct opposite of patient problems. For example, if a patient's problem is decreased exercise tolerance, the goal would be to improve exercise capacity. Therapists may choose to chart either the problem list or the treatment goals, depending on their practice style, but both serve to guide targeted interventions. Once goals are set, therapists determine the best treatment approaches and expected outcomes for each goal. Treatments are prescribed using best practice principles, which means using the most effective techniques available, considering resources like time and equipment. Prioritization is key. Patients with the greatest need receive the most urgent interventions. Best practice means balancing physical therapy interventions with other treatments and the patient's daily activities. Therapists must coordinate with other healthcare providers to ensure that interventions are safe, effective, and integrated into the patient's overall care plan. This holistic approach maximizes the benefits of therapy and supports optimal recovery. Dean's physiological treatment hierarchy provides a guideline for treating impaired oxygen transport. The premise is that being upright and moving is the optimal physiological state. The hierarchy starts with mobilization and exercise, followed by body positioning, coughing maneuvers, relaxation, range of motion exercises, postural drainage, manual techniques, and suctioning. However, treatment plans must always be customized to the individual patient's needs. Mobilization and exercise are at the top of the hierarchy because they stimulate multiple steps in oxygen transport. The goal is to elicit both acute and long-term benefits, improving cardiovascular and respiratory function. For most patients, getting them upright and moving is the most effective way to enhance recovery, unless contraindicated by their condition. Body positioning is used to simulate the effects of being upright, relieve dyspnea, and promote optimal hemodynamics and ventilation perfusion matching. Proper positioning can also help with alveolar ventilation and facilitate mucociliary transport, making it a key tool in managing respiratory symptoms and improving patient comfort. Coughing maneuvers and airway clearance techniques are essential for patients with retained secretions or airway obstruction. The goal is to clear mucus with minimal adverse effects on airways and the cardiovascular system. In some cases, such as severe atelectasis, airway clearance may take priority over mobilization. Relaxation and energy conservation techniques help minimize the work of breathing and the heart, reducing overall oxygen demand. These interventions are particularly important for patients with limited reserves or those experiencing significant fatigue. By teaching patients how to conserve energy, therapists support better participation in therapy and daily activities. Range of motion exercises stimulate alveolar ventilation and help maintain joint mobility, while postural drainage uses gravity to facilitate airway clearance. Both techniques are valuable for patients with limited mobility or those at risk of secretion retention. Therapists select these interventions based on individual patient assessments. Manual techniques, such as chest percussion and vibration, are used alongside positioning to enhance airway clearance. Suctioning is reserved for patients who cannot clear secretions independently. These interventions require skill and careful monitoring to ensure safety and effectiveness. Selecting treatments is guided by the level of scientific evidence supporting each intervention. Grade A evidence comes from well-designed controlled trials with consistent, statistically significant results. Grade B is based on observational studies or less consistent trials, while Grade C relies on expert opinion. Therapists should always aim to use the highest level of evidence available, but must also consider individual patient needs and circumstances. An outcome measure is a tool with proven reliability and validity that tracks changes in a patient's status over time. Good outcome measures are quantifiable, practical, cost-effective, and relevant to the patient's condition. They help therapists, patients, and payers evaluate the effectiveness of interventions and justify ongoing care. Outcome measures must be relevant to all parties involved in patient care: the patient, therapist, and third-party payers. They vary in specificity and evidence base, but their validity is strengthened when multiple measures point to the same clinical change. For example, combining physical findings, imaging, and oxygen saturation data gives a clearer picture of a patient's progress and the impact of therapy.